Okay, I'm gonna do draw out the brachial plexus and talk about the nerves and stuff they innervate. All right, so as you can see, we'll start with the vertebrae. So we have C5, C6, C7, T1. Draw boxes around them, and then draw the roots coming out. These are C5, C6, C7, C8, and T1. These are your roots. And then you have your dorsal scapular nerve that comes off of the C5 root, and that innervates your rhomboids and levator scapulae. And then you go from your roots to your trunks. So draw out your trunks here. So you have your superior, middle, and inferior trunks. Off of your superior trunk, you have the suprascapular nerve, which innervates the supra and infraspinatus. So suprascapular. And these are your trunks. Also, I should point out, from the roots comes the long thoracic nerve, which kind of comes down like this, and every root kind of joins into it. So you have the long thoracic nerve, and that innervates your serratus anterior. All right, from the trunks, we go to our divisions. So continue on with that. One sec. So in your divisions, you just gotta label anterior and posterior. So we have your anterior, posterior, anterior, posterior, posterior, anterior, and these are all your divisions, your clavicle. Just through all of these. Okay, and then when you go from your divisions, you have your chords. So this is where it gets a little bit complicated. You have your lateral, posterior, and medial chords. So off your lateral chords come these two nerves. We have 3 here and 4 here. So we're going to go through each of these individual nerves innervated. So off our lateral cord, we have our lateral pectoral nerve. Our lateral pectoral nerve innervates the pec major, and then we have the lateral contribution to the medial pectoral nerve, and the medial pectoral nerve, we'll talk about that more later. So here's in the posterior cord, we have the upper, middle, and lower subscapular nerves. The upper subscapular nerve innervates the supraspinatus, or the supraspinatus. Sorry, the subscapularis. The middle subscapular nerve innervates is also known as the thoracodorsal nerve. It innervates the latissimus dorsi, and the lower subscapular nerve innervates also the subscapularis and the teres major. And then we get down to our 4. Hold on, add a 4th. Our 4 nerves that come off of the medial cord. We have you have the medial pectoral. The medial pectoral, it connects with the branch that comes from the lateral pectoral. The lateral contribution to the medial pectoral. The medial pectoral goes through the pectoralis, the pec minor, and innervates the lower half of the pec major and the pec minor. Then you have the medial contribution to the lateral pectoral, which we've already talked about. And then we have the brachial cubital and the antebrachial cubital, these two, which are just sensory nerves in the arm. All right, from our chords, we have our branches. So we're gonna do our M here. Put it kind of down a little bit. Make it nice and big. All right, and then our marmu. Okay, so we have our musculocutaneous nerve. The musculocutaneous nerve it pierces the coracobrachialis and innervates the anterior compartment of the arm that we talked about in the last video. And then we have the axillary nerve. The axillary nerve innervates the deltoid and the teres minor. We have a radial nerve, which innervates the posterior upper extremity muscles. So those three. And then we have the median nerve. The median nerve innervates the thenar and the flexor forearm, and the ulnar nerve innervates the hand. So that's the brachial plexus, the nerves, and these are the things that they innervate.